we're going to talk about one that I mentioned last time we were chatting, and that was nettle. Those young, fresh nettle leaves are so delicious and so nutritious that it works so well in allergy. And we see that because there it is causing an allergy. And it is really commonly used, it's commonly eaten. And it's also really good for osteoarthritis and joint pain as well because of the heating. Because it warms. It's a great tonic for everyone. All of those arthritis and allergy symptoms are just improved immensely. Hello and welcome. Mentoring with Geraldine is a bite-sized practitioner podcast for naturopaths, nutritionists, herbalists, and practitioners. This podcast responds directly to your needs, the needs of the practicing natural therapist. With interviews, herbal discussions, something business and something clinical each week, you'll get the variety you need and enjoy to stay motivated in practice. Hello, everybody, and welcome back to Mentoring with Geraldine and the Bite Size Podcast. And today I've got Christine from the Herbal Extract Company. She's their researcher, and I'm sure you've heard her talk before about all their beautiful herbs, their one-in-one extracts. And today we're going to talk about one that I mentioned last time we were chatting when we were talking about dandelion, and that was nettle, because of course it's in the garden. Now we're entering summertime here, or we're in summertime by the time this is published. And so you won't be seeing any nettle in the garden right now, but heading into winter and during winter time, nettle is everywhere. And it's here in Adelaide as well. I can grow my nettle beautifully in my back garden and I eat it. I put it in stews and soups, and I use it as a regular green in my meals. So, but the herbal extract itself obviously has lots going for it and does a few different things. So tell us about it, Christine.
Yes, and like you said, it's very similar to dandelion leaf. We're talking about the leaf today as well.
The nettle, yeah.
The root can be used as well, the same as dandelion, but we'll talk about the leaf. And again, it's great, nourishing. It sort of borders between food and medicine. A great spring cure, just like the dandelion leaf. It doesn't grow so much here in Sydney in an urban environment, but it does if you go into the country. It is everywhere. And, you know, it has a great sort of history, especially in Europe, of, you know, like when they used to have these really long, difficult winters, and then spring comes and it's really nourishing vegetable for, you know, all the peasants back in the day to try and get healthy again after that long, harsh winter. So, you know, I think what it's most famous for is it's called stinging nettle, the common name. And, you know, it's got these little white hairs that are like a glass-like hypodermic needle, yes. Which is why it's called stinging nettle, because when the spikes pierce the skin, they inject actually formic acid along with a few other substances, but the same thing that when you get bitten by an ant or a bee, it's the same chemical that makes it sting. Yeah. So it's not pleasant.
No.
And, you know, the saying goes that anything that goes to that length to protect itself is obviously guarding something that's worth having. It's really, really nutritious.
Yeah.
So it was used a lot for convalescence and lethargy and recovery from childbirth and that sort of thing. So that hence why it's one of the most commonly used plants in the world, because of its nutritional qualities.
Yeah. It's and I mean, in Europe, of course, it grows but close to dock leaves, because that's the traditional remedy. Is if you walked through stinging nettle, you'd grab a dock leaf and you'd put it on your skin. So, but I've not seen any dock leaves growing, and I certainly don't have any in my back garden. I don't have a big garden, but I have a nettle patch, because those young, fresh nettle leaves are so delicious and so nutritious that I actually have a dedicated little spot for it. But it works so well in allergy, and we see that because there it is causing an allergy. So it works through all the systems that really support allergy sufferers to help them out. And it is really commonly used, it's commonly eaten, and but it's also really good for osteoarthritis and joint pain as well, because of the heating, because it warms. So, and it warms the space. Now, I've never personally put it on the skin, as a poultice. I've not been brave enough, but I guess that's a possibility.
I think that was in the old days. It was called urtication, which is coming like the botanical name Urticaria dioica. And in the old days, they did used to just get the plant and hit the area that was, or flogging is what it was called. That was a traditional remedy, chronic rheumatism and, muscle weakness. So yeah, and I'm not sure people are going to do that these days. But,
no. I think I'd rather just take it as a 1-in-1 extract along with the rest of the remedy that I needed for what was wrong with me.
But yeah, if someone has very bad joint pain or arthritis, it would be worth trying if they do have nettles, and studies have shown that it works.
Yeah.
But yeah, as you said, it's a natural antihistamine for inflammation and allergy. Even though the stinging hairs, as well as formic acid, they inject histamines into the skin. So, but paradoxically, it's also good for allergies.
Yeah.
So, and there's been randomized trials in humans. Not a lot. There's one like on 37 people. But
it's a start. You've got to start somewhere.
Yeah, exactly. They had allergic rhinitis or hay fever.
Mm-hmm.
And took it for 1 month, and there was a significant improvement in the symptom severity. And so that was observed in that study. So anyone who has hay fever in spring, when all the nettles coming out, it's really good for that. I have just talking about its nutrition. You can sort of see it's our raw material there. You can see the dark green.
Yeah.
It's just chopped there. And then I have our 1-in-1.
As you can see it swirling around. You can see the green swirling around.
I don't know if you can see that on the camera. I have to need to
So those on the podcast channel will see how green, like deep, luscious green.
Very almost need the light to go through it, but I can sort of see it in the picture here, but it's hard to get the green. But you can see how dark it is.
Yes.
It's full of nutrients. I wonder if I put a bit back in here. Yeah, you can sort of see it more here.
Oh, yeah. Look how green that is. You can really see the absolute green for those people who found the YouTube channel and can look at it. So it's a phenomenal green for those of you who can't see it.
Very dark green.
It's very beautiful, vibrant green, and you can just see all that nutrition.
Nice smell. Organoleptics.
Yeah.
Very green smell. You can actually smell the nutrients. It's amazing.
It's a great one. It's a great one. I mean, you don't, again, when you're eating these things, you don't need to put much in to gain all of that nutrition. And the younger, fresher leaves are the ones that you want to cook. Obviously, you want to wear gloves when you're harvesting your nettles because of the sting that you will otherwise receive in your hands. When my nettles leave my nettle patch and head into the garden, often I'll be out there and I'll think, it's not meant to be there, and I'll pull it out and go, it's the nettle, shouldn't have touched that one, that was foolish. So
it's reminding you how powerful it is.
Yeah. So,
and just with the osteoarthritis and joints, really alleviating the symptoms of those, there has been a study where it worked in combination with the non-steroidal anti-inflammatory drug. So that's sold under the brand name Voltaren. Most people might know.
The brand.
We sort of, NSAID, we shorten the non-steroidal anti-inflammatory drug to that. So patients who eat on those were able to, and again, it was in 37 people. It was kind of weird. It was the same as the last one, but they had acute arthritis. They actually used stewed nettle leaves, 50 grams a day, combined with this Voltaren over 2 weeks. And they were able to, so it could be used in combination, which is good to know because, as we've spoken about before, often it's difficult to know if you're on pharmaceuticals, whether you can take herbs. And there's not many studies to show. There's a few that we really know about, but often it's very difficult to know. But this study has been done with patients taking the Voltaren, so they could reduce the dose because these non-steroidal anti-inflammatory drugs increase your risk of heart attack and stroke. So there's side effects, and you don't want to be taking them long term if you can help it. So if you can decrease the use of them by taking herbs at the same time,
that's perfect.
Yeah,
because there's so much, if members of the general public are listening and they go out and they get themselves a naturopath or a nutritionist or herbalist or whoever it is, they're going to be working on the drivers. And so when we add things, we add them to support the change that the person will undergo by seeing a qualified practitioner. And the practitioners who are listening will get that little reminder about, nettles, I could actually be, it's the right season that they are around me. I could be getting my client to ingest them, to eat them. And I can get them to have the tea. I can get them, the herbal tincture to go in there.
Tincture is good because you can formulate it into what other herbs you're putting in, and then that's just one less thing.
Yeah.
To do. And you can see the nutrition's still there in the fluid extract.
Yeah. And it can eat
like a tonic herb.
Yeah, it makes a lovely tonic. It's a great tonic for everyone. So all of those arthritis and allergy symptoms are just improved immensely with the addition of nettles. So something, again, very traditional that we do use and on a regular basis in herbal practice. So, right. Well, I think it's probably time to go and to wrap up our bite-sized podcast. So thank you very much, Christine, and the Herbal Extract Company. And I look forward to speaking to you again very soon. Thanks so much for joining me today. Don't forget to rate, review, and subscribe to the podcast for the weekly episodes. If you'd like even more support and learning, then the Academy is for you. Here you'll find part 2 of the herbal discussions, more clinical learning, and case studies to support your clients in practice. Bye for now.